All right, we're looking at a serious COVID spike in the country. Let's take you through the numbers across India. We're looking at a total of 168,063 COVID-19 cases that have been reported overall. In the last 10 days itself, we're seeing a spike which has jumped past 1 lakh. Delhi, that sees a large number of cases, including Maharashtra, Karnataka, Tamil Nadu, West Bengal. Of course, Maharashtra reporting 33,470 cases in the last 24 hours. Delhi has reported 19,166 cases in the last 24 hours, while Tamil Nadu, West Bengal has reported 19,286 cases. Tamil Nadu has recorded 13,990 cases in 24 hours, with Karnataka reporting 11,698 cases only in the last 24 hours. Now, India's new COVID cases dip over 6%. In fact, the last 24 hours, as much as the COVID cases have gone up, it's still better in compared to the last few days. The country has reported over 168,000 COVID cases and 277 deaths in 24 hours. But compared to yesterday, the total number of fresh COVID cases is down by 11,660 today. However, the daily positivity rate of the country still stands at 10.6%. Maharashtra is the worst hit state with 33,470 cases, followed by West Bengal with 19,166 cases, and then Delhi at 19,286 cases. Maharashtra alone is responsible for 19.9% of the new COVID cases in India. Now, owing to the prevalent situation, Prime Minister Narendra Modi will be holding a video conference with Chief Ministers of States on Thursday. Medical expert Dr. Arvind Taneja has claimed the third wave will peak by next week in Delhi and Mumbai. He's further said that the wave will wane out by the end of this month. Meanwhile, over 9 lakh booster doses were administered on the first day of the rollout. Over 7 lakh frontline workers took the precautionary shot, and little over 2 lakh beneficiaries were 60 plus, having comorbidities.
The third wave has already hit, I would say, in all the major cities or large cities of the country, and it's just a question of time, and that time is not more than 2 weeks more or 3 weeks more when it will hit the entire country, whether it's a small village or it's a small town or whatever. It's come like a tsunami, and it will disappear like a tsunami.
In the last 24 hours, Mumbai have registered over 13,600 new cases of COVID, while 5 people have died due to COVID. Now, the experts believe that the lesser numbers are due to the lesser testing done in weekends, that is on Saturday and Sunday. The experts also say that many of the people are home testing and also consulting their family doctors, and therefore the total number have been registered less. The BMC officials are telling that they will continuously monitor the situation for few more days, after which they can ascertain that whether the cases have come down or they have increased. On restrictions, that the BMC officials are saying that no further restriction, but yes, if the cases increase, then restrictions can be applied. With camera person Vijay Desai, this is Saurav Vaktania in Mumbai for India Today.
With 19,286 new COVID-19 cases being reported in the last 24 hours, it is a challenge for the West Bengal government to restrict people from going out in public places in large numbers without masks. Right now, there is a curfew from 10 p.m. to 5 a.m. and there is strict checking by the police officials. And also, apart from that, what we know is that the COVID-19 vaccination is underway when it comes to the precautionary dose, which has started since Monday. But the challenge is that 40% of the population is yet to take the second dose of the vaccine, and the West Bengal government is urging people to come out and take the second dose so that the population can be immunized at large. With camera person Taposh Berry, Prema Rajam in Kolkata for India Today.
Now, COVID surge in the national capital continues. Delhi has recorded 19,166 cases and 17 deaths, with positivity rate now mounting to 25%. However, infections were slightly lesser than the previous day. On Sunday, the national capital has recorded 22,000 cases. COVID infection has hit Delhi police with 1,000 personnel testing positive. The Delhi Disaster Panel has imposed new restrictions in the national capital to stem the rising cases. Private offices have been shut. Work from home has been made mandatory. Private offices providing essential services will be allowed to function. A complete ban on dining in at restaurants has been banned. In fact, it's only takeaway and home delivery that will be allowed. Shops inside malls and at marketplaces are operating on odd-even basis between 10 a.m. and 8 p.m. whereas only one weekly market allowed per zone. With new restrictions in place, weekend curfew will continue in the city. Meanwhile, Delhi Chief Minister Arvind Kejriwal has announced special yoga classes for COVID-positive patients under home isolation. He said that yoga will help people of Delhi in the fight against COVID.
जो लोग होम आइसोलेशन में इस टाइम हैं, उनके लिए स्पेशल योगा के और प्राणायाम के कुछ क्लासेस हम लोग शुरू कर रहे हैं, ऑनलाइन क्लासेस। वो अपने घर बैठे हमारे इंस्ट्रक्टर के साथ योग कर पाएंगे। इसके लिए हमने पूरी तैयारी कर ली है। इंस्ट्रक्टर्स की एक बहुत बड़ी टीम तैयार की गई है, जिनको स्पेशल कोरोना से संबंधित कौन कौन से आसन हैं, कोरोना से संबंधित कौन कौन से प्राणायाम हैं, इनकी ट्रेनिंग, स्पेशल ट्रेनिंग दी गई है इन सभी इंस्ट्रक्टर्स को। पिछली वेव के मुकाबले में ये वेव बहुत माइल्ड है। ये ऊपर वाले का शुक्र है कि हम लोग सब एक बहुत माइल्ड वेव से डील कर रहे हैं, नहीं तो दूसरी जो अप्रैल में वेव आई थी वो बहुत ज़्यादा खतरनाक थी। इस वक्त जैसे 136 मरीज़ ओमिक्रॉन कोरोना के यहाँ पे अभी भर्ती हैं। 136 में से केवल 6 पेशेंट्स ऐसे हैं जो कोरोना के इलाज के लिए आए थे। बाकी 136 में से 130 पेशेंट्स ऐसे हैं जिनमें इंसिडेंटली कोरोना निकला। वो किसी और बीमारी के लिए आए थे लेकिन इंसिडेंटली कोरोना निकला।
Hotels still were suffering because unless and until travel really starts, there will be no business in the hotels. In the first COVID wave, the performance went to 1 to 3%. Obviously, everything was shut down. The second COVID wave, it came down to about 11 to 15%. Situation is really grim. We have to realize that this is the only sector which has been hit badly. I mean, of course, all of them have been hit badly. This is the worst.
देखिए, नंबर तो बढ़ते जा रहे हैं। अगर आप पिछले 8-9 दिन से ही देखें तो ऑलमोस्ट 4-5 टाइम्स हो गए हैं। कहाँ 200-300 जैसे दिल्ली में शुरू हुए थे, कहाँ 20,000 क्रॉस कर चुके हैं। जिस तरह से नंबर बढ़ रहे हैं तो ऑलमोस्ट एक पीक आने वाली है जनवरी में। और मैं आशा करता हूँ जैसे जो साउथ अफ्रीका में हुआ था इस पर्टिकुलर स्ट्रेन में, सीधा ऊपर गई थी और सीधा ही नीचे आई थी। तो मैं बहुत उम्मीद करता हूँ कि जिस तरह से अनफॉर्चुनेटली ऊपर गई है, आई होप फॉर्चुनेटली वो नीचे भी आए और सडन फॉल भी हो, स्टीप हो।
Now, the COVID third wave is here as India witnesses a massive spike in coronavirus cases. The caseload is rising at a much faster pace this time as the country has breached the grim mark of 1 lakh cases per day in just the last 10 days. But will we witness a third wave peak anytime soon? And what is it really going to do to the country? Sneha Mardani with more on that.
The third wave is sweeping India. The country is seeing an exponential growth in COVID cases. India reached the 1 lakh mark in just 10 days this time. The 1 lakh figure was reached in the second wave in 50 days and 120 days in the first wave. On Monday, India reported close to 2 lakh infections. Mathematical projections indicate that this is going to rise further.
ये बहुत ज्यादा तेज फैलने वाली सुनामी जैसी लहर है। जो आंकड़े हम देख रहे हैं, ये पहले आंकड़े कभी नहीं देखे। टेस्टिंग संख्या और टेस्टिंग लैब्स के ऊपर भी उसका थोड़ा स्ट्रेस हो गया है। तो टेस्टिंग लैब और इंफ्रास्ट्रक्चर पे स्ट्रेस जरूर हुआ है, लेकिन उसकी जो तीव्रता है, जैसे आपने सही बताया, वो बहुत कम है। और अस्पतालों में अभी अगले 2-3 हफ्ते में हमको पता चलेगा, बहुत ज्यादा इसका इम्पैक्ट नहीं होगा।
While experts differ on when India will peak, most agree cases will decline by the end of February.
In cities like Delhi, Mumbai, where the numbers have been rising very fast for past week or so, they will continue to rise very sharply, with the peak estimated somewhere around middle of this month. That is, in about a week, 10 days from now.
India had such a terrible Delta wave. That combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February.
Doctors say it is not the caseload we should be looking at this time, but hospitalizations and ICU admissions.
What is different from the Delta wave so far has been that the number of people who require inpatient hospitalized care is substantially lower than it was for Delta.
Sources within the INSAGOG, the consortium of labs undertaking genomic sequencing in India, say that in metropolitan cities, the prevalence of Omicron is to 90 to 95%. They also say that Omicron is well on its way to replace Delta as the predominant variant in India. Well, the rate of infection is much, much more. But hospitalization and oxygen use is not alarming. Far from it is what sources indicate. In New Delhi, Sneha Mordani for India Today.
Now, concerns have grown over the COVID cases in children. There has been a steep spike in hospitalization of children in the United States. While the trend of COVID cases in India seems to be different, doctors still claim that they are vulnerable to infection from the Omicron variant, which is anything but mild in children getting infected. Milan Sharma with more on that.
Omicron has led to a surge in hospitals in the United States. While the new variant of coronavirus is believed to be milder than Delta, more children under 5 years are reaching the hospitals in America. Last week, a record number of children ended up in hospitals across the US, the highest level since the pandemic began. Since mid-December, the hospitalization rate in these youngest kids has surged to more than 4 in 1 lakh children, up from 2.5 per 1 lakh. The rate among children between the age of 5 to 17 is about 1 per 1 lakh, according to the CDC. This data is drawn from over 250 hospitals in 14 states in the US.
So Omicron, again, is less virulent or dangerous than prior strains. And most children that get Omicron have no or mild symptoms. Rarely, children can progress to severe disease. It's rare, but it can happen. About 2% of the COVID hospitalizations in the United States are in children. 99% of the hospital admissions can be prevented if children were just fully vaccinated.
The US experience with Omicron could hold lessons for India. Children here too can be vulnerable. Sources tell India Today that 2 children aged less than 2 years were admitted for COVID treatment in Delhi's Chacha Nehru Bal Chikitsalaya Hospital recently.
Despite the fact that these 2 children tested positive, they were critical and admitted in the hospital. This brings in the argument that whether children can handle COVID better should change at the moment since they are not vaccinated, and also in the light of Omicron that causes different symptoms from the Delta, how much are children protected or how vulnerable they are needs to be reassessed.
Doctors say symptoms among children aged below 18 are not mild this time, though most cases don't lead to severe disease.
Regarding pediatric, severity is almost same as compared to the Delta. In adult, as compared to the Delta, severity has gone down. Probably because of vaccination, that might have contributed. So in pediatric, severity is same.
Data on children's hospitalizations has so far not been provided by the authorities in India. However, if the US data is anything to go by, children too are vulnerable to severe illness from COVID. With Milan Sharma, Bureau Report, India Today.
Now, ahead of assembly elections in Punjab, cross-border groups, be it Pakistan-based terror group or Khalistani separatist group, all are in top gear now, peddling fake propaganda to create disharmony. Here's more on, in fact, Tanseem Haider and Mohit Sharma brings us a perspective on that.
With Punjab elections round the corner, the United States-based separatist organization Sikhs for Justice is at it again. This time hatching a conspiracy to target India on the 73rd Republic Day. Several social media handles linked to Sikhs for Justice have called for blockades at India Gate and Red Fort on January 26th. Wishing for a rerun of the anarchy that marred capitals' streets on January 26th last year. They called upon their supporters to raise the flag of Khalistan in the place of the tricolour. The band outfit has announced a $1 million fund for the mission. And it's not just Sikhs for Justice. Across the border, Pakistan fake factories are into overdrive. Many fake handles have been found by Indian agencies that have been peddling Khalistan and farmer protest narrative. Some accounts based out of Pakistan have also been found reigniting sacrilege issues to create disharmony ahead of the state elections. The nefarious plot to target India stands exposed. Now the question is, what steps are being taken by the government to check outfits like Sikhs for Justice? With Mohit and Tanseem Haider in Delhi, Bureau Report, India Today.